Good morning, everybody. Ron Ray here with Turning 65 Solutions. And for this morning's video, we're going to cover a question that we get often. That question is, does Medicare cover ambulance services? And secondary to that, does it cover helicopters and airplane transportation if you need that? And the answer is almost always yes. And so we'll explain how this works. And our source for today's information is straight from the horse's mouth right here at Medicare.gov, and they have a search tool on here where you can search for any service or procedure that you can think of, and it'll tell you whether it's covered or not and how that coverage works. So in this search, I simply just typed in the word ambulance, and it gave me these results: ambulance service. First thing you need to know is under original Medicare, ambulance services are covered under Medicare Part B. Remember, it's outside the hospital. An ambulance is taking you to the hospital, where if you're admitted and you spend a night, typically it'll be covered under Medicare Part A. But the ambulance ride itself is covered under Medicare Part B. Okay, that's with original Medicare. Under Medicare Advantage, it's going to be covered under the ambulance benefit of the Medicare Advantage plan, and will be subject to whatever out-of-pocket that particular Medicare Advantage plan has for ambulance services. Okay, but let's talk about original Medicare. With Medicare Part B covers ground ambulance transportation when you need to be transported to a hospital, critical access hospital, or skilled nursing facility for medically necessary services, and transportation in any other vehicle could endanger your health. So what they're saying is it doesn't necessarily need to be an emergency. So it's not you had a car crash or you had an accident and they're rushing you to the hospital, but it could simply just be transporting you to an approved healthcare facility or location when it's necessary medically that you cannot ride in another vehicle. So let's say maybe you are bedbound and on oxygen and you need to be transported to a dialysis facility. That's not an emergency, but that sort of thing would be covered. Medicare will pay for emergency ambulance transportation in an airplane or helicopter to a hospital if you need immediate and rapid ambulance transportation that ground transportation can't provide. So if you need to get to the hospital faster than an ambulance can get you there, Medicare will cover a helicopter or fixed-wing airplane, or if a helicopter is not an appropriate, fixed-wing airplane, regular airplane, when appropriate. In some cases, Medicare may pay for limited medically necessary non-emergency ambulance transportation if you have a written order from your doctor stating that ambulance transportation is medically necessary. For example, someone with end-stage renal disease, just like I gave in my example, may need medically necessary ambulance transport to a facility that furnishes renal dialysis. Now here's the important part. What do you pay? Under original Medicare, Medicare Part B pays 80% after the deductible, which this year, 2021, is $203, and then you pay 20%. So if you've not met that $203 deductible, you pay that first, and then you pay 20% after that for ambulance services, whether it's an emergency or not, as long as that transportation is Medicare approved. Now here's a couple of things to note. Your doctor or other healthcare provider may recommend you get services more often than Medicare covers, or they may recommend services that Medicare doesn't cover. If this happens, you may have to pay some or all of the cost. Ask questions. That is very important. You have to ask the questions so that you understand why your doctor is recommending certain services and whether Medicare will pay for them. Okay, so this can get complicated when we're talking about non-emergencies. So Medicare will pay for a lot of that. They won't pay for all of it. So it's important that you ask questions. Is this transportation covered by Medicare? Because if it's not covered and you didn't ask, well, guess what? You're going to have to pay it out of pocket. Second thing to note here is to find out how much your test item or service will cost. Talk to your doctor, healthcare provider. The specific amount you owe may depend on several things like other insurance you have, your supplement or Medicare Advantage plan, how much your doctor charges, whether your doctor accepts assignment, the type of facility, where you get your test item or service. So again, you have to ask the questions. Medicare will only cover ambulance services to the nearest appropriate medical facility that is able to give you the care you need. The ambulance company must, so that's one thing. I'll stop right there. Medicare will only cover ambulance services to the nearest appropriate medical facility. So if there's a dialysis center 2 miles from your house, Medicare probably isn't going to pay to drive you to a dialysis center 30 miles away because you like them better, they're more comfortable, or they give you something. Okay, so they're going to pay for the nearest appropriate facility. The ambulance company must give you an advanced beneficiary notice of non-coverage when both of these conditions apply. So what is an advanced beneficiary notice of coverage? In original Medicare, a notice that a doctor, supplier, or provider gives a person with Medicare before furnishing them an item or service if the doctor, supplier, or provider believes that Medicare may deny the payment. Okay, so if they feel like Medicare might deny the payment, they have to give you this notice if these two conditions apply. You got ambulance services in a non-emergency situation, and the ambulance company believes that Medicare may not pay for your specific ambulance services. So they have to give you a notice if they think that Medicare is not going to pay. Now, if they don't give you the notice, they can still send you a bill, and then it's up to you to fight that bill and not pay it. So please ask questions. Okay, and then the last part down here just applies to certain states. We, of course, work in Texas and a few other states around the country, so we'll skip that part. So the question, does Medicare pay for ambulance services? The answer is in an emergency, always, and in non-emergency situations, usually, but some conditions apply. So ask those questions. If you have any other questions about this, give us a call. The number is 830-217-6711. Also, check us out on the web at www.t65s.com. Folks, if you found the information in this video helpful, please give us a thumbs up down at the bottom here, and that helps YouTube get this video out to other people who are searching for the same information that you were. And also subscribe to the channel on the button down below, and then you can be notified when we upload a new helpful video. So we hope you did find it helpful, and until the next video, hope you have a great day. Bye, folks.